Okay, we already talked about try one thing at a time. Okay, if you're going to do a medication, it should have an obvious beneficial effect. And you want to make sure you don't start the medication at the same time you start a diet or a new school. Otherwise, how are you going to know what works? At least have a few weeks in between them. If somebody's on a cocktail of garbage and you got to get rid of some of it, take them off slowly, one at a time. Be careful switching brands of generics. They are not bioequivalent. I have found that with my 2 medications, because I also have to take Diazad, a water pill for my Meniere's disease, and I found that the cheap Diazad at the supermarket did not work as well as the generic Diazad I got from the little specialty store. You know, so generics are fine, but don't be switching brands. Stay with one brand. And don't expect any medication to give you 100% of control of symptoms. It's not going to do it. You get 80 or 90% control, that's wonderful. And don't go out and get more and more prescriptions every time there's some crisis. I want you to think extremely logically about what you do. And a lot of stuff that's been done with medication and with all the alternatives. Somebody's taken out 50 different supplements. Well, that's ridiculous too. You need to figure out what works for you. Some of the vitamin things work. Some of the probiotic things definitely work. You know, there's digestive enzymes I want to learn more about. You know, that might be worth taking. But try different things, but don't be taking 100 different things. Okay, if you have especially a nonverbal person who has anger attacks out of the blue, there might be a psychomotor epilepsy, and you're not going to find it on the EEG unless you do a sleep-deprived, fully awake EEG with no sedatives. Yeah, have fun, because they're going to tear all the wires off. Because as soon as you give them a sedative to do the EEG, it's not going to work. You'll cover up these little mini seizures. But drugs like Depakote, you know, seizure medication, can sometimes help with anger outbursts that are like almost random. I mean, there's nothing that triggers it. And Depakote's an effective drug. You absolutely want to make sure you don't get pregnant on this stuff. And with epilepsy drugs, also there's Lamictal and Tegretol and a whole bunch of epilepsy, Topomax, a whole bunch of epilepsy drugs. You have to do blood tests out of the arm to make sure you're not getting liver damage. Now, if you're using the SSRIs or the atypicals, you don't have to do any blood tests. No blood tests are needed. But if you use anything that's an epilepsy drug, they're also called anticonvulsants. Any drug in that class, you must do blood tests. You take a baseline, and then you do them like 3 more times, and then if it starts to mess up your liver, you can get off of it before it does anything. But you got to do blood tests. My student had migraine headaches. A health service at school gave her some free samples of some unknown epilepsy drug. I don't know what it was. They didn't do blood tests. She was almost dead from liver failure 8 months later. You have to do the blood tests. They're the nasty big ones out of the arm, because there's a genetic thing on who's going to have this problem. Now, in the future, there'll be one little simple blood test they could do to see whether it's safe for you to take these drugs, but that doesn't exist yet. But as long as you do your blood tests, then you're not going to have that problem. Okay, here is an old drug. I have this old-fashioned slide here for this old-fashioned rediscovered drug, beta blockers, propranolol. It's an old blood pressure medicine. It's a great anti-anxiety drug. I think it's absolutely disgusting the amount of Valium and stuff like that's being given out, and that's a controlled substance and addictive. This is not a controlled substance. It's just a blood pressure pill. Musicians take them before concerts so they don't get so anxious. It's being used now with veterans that have post-traumatic stress disorder, too. And it works really good for the kind of like anger and anxiety where they get all hot and sweaty, all kind of hot and sweaty and out of breath. It sometimes really works well for them. And I know somebody right now that's taking some Prozac, and then he still couldn't sleep, so he takes a beta blocker at night. Sometimes Prozac and beta blockers together, oh man, sometimes works like magic for getting the fear and the stress damped down. 2 old, cheap drugs. Now, the thing that's a problem is that nobody pays for research. The only reason we're getting research done on this is because the U.S. Army's paying for it, because this is useful for veterans. And it's getting rediscovered. Private industry isn't going to pay for research on beta blockers. They're cheap old generics. They don't care about them. Okay, how about ADHD drugs and autism? Things like, Ritalin, Strattera, all your different ADHD drugs. The stimulant drugs tend to make classical autism worse. Where the child was, had speech delay, tends to make them just crazy. The thing about ADHD drugs, when you try them, you're going to know right away whether they're good or bad. Stimulants, 1 or 2 pills is all it takes, you'll know. Now, the kids that are labeled mild Asperger's, they tend to work. And this is the kind of Asperger that gets mixed up with ADHD. And they often work for those kids. Stimulants actually have a very good safety profile. They've been around for a long time. You can drown rats in Ritalin, and it's not going to wreck their brains. I've actually read a paper on that. When it comes to long-term safety, they have much better profile than the atypicals do, the ones that I called heavy artillery. You've got to look up drug interactions, and a lot of herbal stuff interacts. Cold pills interact really, really badly with antidepressants. The cold pills, a lot of sinus pills, allergy medicine, they can sometimes make antidepressants not work. Herbal things can sometimes make drugs not work, and some of those interactions are not listed. I take this stuff called yeast cleanse, and I looked up every ingredient on the internet. I spent 2 hours on the internet looking up interactions. I couldn't find any. And I had to take antibiotics when I got bronchitis, and the yeast cleanse made the antibiotics not work. I was on the antibiotics for 4 days. Didn't seem to be working. I stopped taking the yeast cleanse, and I still had 7 days left on the prescription, and the antibiotics worked. So I'd recommend that if you have to take antibiotics or AIDS medication, you probably don't want to take a lot of herbal things. I'm not saying don't use them. St. John's wort's really bad for making other drugs not work. St. John's wort works as an antidepressant. But you've got to really watch your interactions. Everything interacts to a certain amount. This is one of the reasons why you don't want to be taking 25 different things. Okay, special diets we talked about, exercise, omega-3 supplements. Omega-3 supplements are getting good science behind them now for a lot of different things. The omega-3, fish oil, flax oil, things like that. Getting really, really good. I have a typical autism profile, anxiety and depression on both sides of the family. My grandfather was an MIT-trained engineer. In fact, there's more research has shown that in autism, there's more engineers in the family history. Food allergies, both sides of the family kind of contribute to it. Einstein, we already discussed that he'd be diagnosed autistic today. And the thing that worries me is, what would happen to Einstein today, in today's educational system? Would he be driving a truck somewhere? Here's a great book for kids getting teased in school. It's about famous scientists and musicians that probably were Asperger's.